Good evening. I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge topics to the Staten Island and tri-state community. I want to thank everyone for voting us one of the best Staten Island healthcare cable health show, and we want to say thank you to everyone who voted for us, and even people who didn't. It's a pleasure to be associated with the show and our wonderful viewers. Tonight's topic is Update in Pediatrics, and we have three wonderful, wonderful guests, and I'm going to introduce them. Dr. Miroshnichenko, she's the Chief of Developmental and Behavioral Pediatrics at Richmond University Medical Center. Dr. Mendez, who's the Chief of Ambulatory Pediatrics at Richmond University Medical Center, and Dr. Ishita Kharode, who's the Chief of Pediatric Endocrinology at Richmond University Medical Center. Welcome. So we're going to jump into pediatrics, and if you think about it, pediatrics is such a broad topic. It's interesting in my practice, I'm seeing, people seeing their pediatrician a lot longer, interestingly enough. So you start from birth, and then some people said 18, 21, and this week I saw someone who came in who was 24 years old, or 20, with a headache, and it's a neurologist, I see people with headaches, who said, who referred you to the office? Oh, my pediatrician last week. So it's sort of interesting, the age group that pediatrics goes, and I think that really it's a testimony to really the comfort that they are with their pediatrician, that they don't want to change, and I think that's wonderful, and I think you guys all are part of that. So we're going to talk to Dr. Kharode about pediatric endocrinology, and we're going to talk about really an update of what's really cutting edge. So for our viewers out there, endocrinology, and we'll talk about what it takes to be an endocrinologist, hormones. So tell us a little bit about what a pediatrician is and what a pediatric endocrinologist is, and maybe why you wanted to go into that field. And what do you usually see, what type of patients or what problems do people have when they come to see you?
Sure. So a pediatrician is a very important person in a child's life because they are the person who takes general care of them from the moment, sometimes as a newborn, all the way up until, as you said, into young adulthood or adulthood. And they, see them for checkups. They see them if they're not feeling well, and if they do have any concerns that prompt the consultation of a specialist, then they will refer them out. And so sometimes that's where I come in as a pediatric endocrinologist. So if a pediatrician has concerns about a variety of things, if they're concerned that a child is not growing as much as they should be, if they're concerned about a child's pubertal development, if they're too early or too late in that process, if they're concerned that the child might have thyroid issues, diabetes problems, metabolic disorders. So there's a number of different reasons to refer to a pediatric endocrinologist.
People refer to you from other doctors when you say like thyroid problems. How would somebody in the community know that they have thyroid problems or sugar problems unless they either had blood tests or they were referred?
Right, so sometimes it is blood tests that are done initially by the pediatrician who had a concern based on certain symptoms. So some of the things we think about in diabetes are if someone is increasingly thirsty or is going to the bathroom more frequently, sometimes bedwetting when they weren't before. So that might prompt some blood work. Same thing with the thyroid. There's a number of symptoms that can be associated with under or overactive thyroid hormone production. And so the pediatrician might do initial blood work to see if something is going on, and if something abnormal pops up, then they'll refer to an endocrinologist.
Tell us about childhood obesity. I mean, we were talking before we came on the air, and you were talking about how prevalent it was and how really it's in the forefront of a lot of treatments with regard to new medications, new things that are being looked at both in the adult and pediatric population. So tell us, when should someone go to a pediatric endocrinologist, or even how concerned going to their pediatrician when someone is overweight?
Right, so obesity as it's defined in the pediatric population is a little bit different than in adulthood. So we look at, first of all, we look at the BMI, which is the weight compared to the height. And in children, we look at the percentiles, not the actual number as we do in adults. So BMI above the 95th percentile for children is consistent with having obesity, but that's only one measure we look at. So just because someone's BMI falls into that range doesn't necessarily automatically mean that they're unhealthy or that there's something wrong. It just is one of the things we look at when we are thinking maybe to look into other potential what we call comorbidities or conditions that sometimes tend to run along with having obesity. So things like insulin resistance, or sometimes it's called prediabetes, You can sleep apnea, obstructive sleep apnea, sometimes associated with that, elevated cholesterol levels, elevated blood pressure. So it doesn't mean that a child with obesity will have all of these things, but it sometimes prompts concern to screen for some of these things. And so when we approach a child whose BMI falls within that range, the first focus is always diet and exercise. So you mentioned medications, and there are more medications that are being approved for, particularly for weight loss in pediatric patients. But the initial approach is always to talk about general health and ways to improve someone's general metabolic health, not so much focusing on weight loss, especially in younger children who are still prepubertal. For a number of reasons. It's not good for their health to lose a lot of weight, but also it's important that they consider their overall health and not so much the numbers. Sometimes that can give them unnecessarily anxiety, or sometimes can lead to disordered eating, and we certainly don't want to do that. So we just encourage healthy habits, including healthy eating, physical activity.
Tell me about your team.
So I work closely with the other pediatricians and pediatric subspecialists at Richmond University Medical Center. Of course, the pediatricians, I get the referrals from some of the pediatricians in our clinic. We have a nutritionist. For children who have diabetes, we have a diabetes educator. And so we all work closely together in referring patients to each other. We also have a pediatric gastroenterologist, because sometimes there can be liver issues, liver difficulties that are sometimes associated with obesity. And so, yeah, we all communicate with each other when we have patients that we're worried about.
And that's the way it should be, of course. So Anna, let's go over some things. We know each other a long time, as we
Yes,
always say.
we do.
And Anna's been was the pediatrician of my kids, and then they sort of got older.
Yes,
So eventually, we're no longer their pediatrician, but we want to say, my family wants to say thank you to you for all the years you were their pediatrician.
Thank you for your trust.
Thank you. So tell us a little bit about, you run an ambulatory portion of the hospital at Richmond University Medical Center. I know you teach medical students, you teach residents. What are the, I think you mentioned to me earlier that you wanted to talk a little bit about immunizations and vaccines. I think that's a really wonderful starting point. And tell us a little bit about what parents, children themselves, and again, sometimes my kids, when they got older, there were some shots we use the word shots, or vaccines they had to get even when they were 12, 13, 14, and they actually had some input into it.
Yes.
A lot younger, they really don't have too much of an input what you're going to do, but later on they have their opinions, and having 3 children, having a lot of opinions is always an interesting event.
Yes, it is.
And I'm sure in your office it is too.
Yes,
So
conversation.
so tell us a little bit about vaccines, and really I want us to try to take the fear out of vaccines. We're not post-COVID, there's still COVID cases occurring, but the idea that, thank goodness, we're able to have this forum here. Usually we weren't allowed to have more than 1 or 2 guests at most, and now we're able to have 3. So things have been changing. So tell us a little bit about really the cutting edge issues with regard to immunizations, and what a concerned parent, guardian, whoever's taking care of someone, really has to think about. And I know there's a long-winded question, but really the fears that they have.
So I think the biggest fear that parents portray to me is, is the efficacy of the vaccine, and are they safe, right? So I want to just step back to something very basic, that if we look at pre-vaccine era, there are diseases that used to kill, disable, or create great burden of disease in children that we don't see anymore. And we don't see it anymore because of vaccines.
So let's mention them by name, because I think that's important for people to hear this.
Polio, right?
Yes.
Polio in the beginning of the 19th century, disabled many kids. If you got tetanus, you would die from it. There's no cure for tetanus, right? Measles, used to have a high mortality rate for infants. Meningitis that we don't see anymore in infants because we're giving the Haemophilus influenza vaccine. Pneumonia that we used to see, it's not happening because of the vaccines. So, going really at the basis of this, their kids, are born, they breastfeed. Breastfeeding is great. It helps to prevent infection from regular germs. And, but it's not enough to fight very virulent, bad germs that really can kill children, right? and that we have prevented with vaccines. So if people think that kids are exposed to thousands and thousands of germs a day as children, even from infancy, and they are able to create immunity, and when you think of a vaccine as having just a small portion of that germ that doesn't infect, doesn't have an effect to create immunity, I mean, I think it puts into perspective this idea of the lack of safety, right? That's number one. Number two, it's really being reinforced, and nothing is more studied in our field in science than vaccines, right? That you really they have to be really safe to be able to come to market, and that we have at least 50 years or more of experience on making vaccines and giving them, saving lives because of vaccines.
Tell us a little bit about almost a theory. When there are moms and dads, parents, who are very protective of their children to stay away from anyone who's sick.
Mm-hmm.
There's a whole second theory that you to go into where everyone is sick and be exposed when you're young and try to build up your immune system. So as a pediatrician, what do you tell them to do?
I think like everything in pediatrics depends on the age, right? Mm-hmm. So if you have a neonate, a newborn, or someone who's under the age of 6 months, you have to be careful and bring them into environments that people are sick and even mildly sick, because their immune system is still developing and not working well in infancy, right? After 1 year, they're better. That doesn't mean you keep them isolated, but the younger they are, the more protective you should be of their immunity. And really, children's immunity is not completely developed until after they're toddlers, right? Usually after the age of 5. That's where most of our vaccines finish, around 4 to 6, right?
Absolutely. I mean, as a neurologist, as a neuroimmunologist who does a lot with disorders of the immune system, the idea about the innate immune system is what we're born with, and then this adaptive immune system, which we're able to attack different kinds of infections or different proteins, we'll call them, or antigens, really does develop over time. And sometimes it goes awry and causes it to be hyperactive, which we see in some of my patients who have things like multiple sclerosis, which our center takes care of. So it's interesting in that regard. Let's talk about COVID. I mean, COVID-19. Should everybody here say it's over? We don't need to be vaccinated, and we're doing well with this herd immunity. We're all sitting at a table here together without masks, pretty close together.
Yes, but we're all vaccinated.
Yes, we are.
5 times myself. I don't know the others.
Or else we couldn't walk into the hospital. That's right.
Otherwise, I couldn't work. And to put into perspective, my own mother got COVID when there was no vaccines yet, and it made her dementia go very quickly, and she passed away within 18 months of that. So, COVID really kills out of experience, But going back to your original question, people have to really see that vaccines really save lives, and that COVID is endemic now. It's come now from a pandemic to endemic. It means it will be with us for the rest of our lives. It's not going anywhere. It's just going to stay and mutate. And the only way we're going to keep up with it is by getting vaccinated, and being able to, almost being almost like the spear of that immune system that you described to really fight COVID. Our immune system adapts, and it has a limit naturally to adapt. Vaccines actually help to completely adapt in certain cases. And we have the luxury and the technology to do it. When just 100 years ago, people would die from simple things that we now don't even see. So, it's really understanding that it's not going away, that we have to have our basic vaccines like we do for polio and tetanus. And then you have boosters, like we do a booster for flu every year, a booster for tetanus every 10 years. So it's the way it is. It's not going away.
Okay. So now we're going to sort of segue into this with Dr. Miroshnichenko, who works in developmental delays, and again, developmental and behavioral pediatrics. So the idea, we were talking about vaccinations a few moments ago. And a few years ago, and still there's a very vocal minority who believe that various developmental delays such as autism, the autism spectrum disorder, is related to the vaccines that children get at different times. So either Anne or yourself could really address this. but I think it's very important for the people who are watching here, the idea about people with autism, children with autism, with their diagnosis, their families, of course, are tremendously concerned. Everybody wants to find some culprit or actually even for in the future find a way to prevent this for others. Tell me about what the science shows and what's your opinion about it, and do you at all recommend in families where, say, there might be multiple members of the family who do have autism spectrum disorder, maybe not getting vaccinated, or what are the thoughts in the community right now?
Sure, sure. And I would like to continue the conversation. I think it's the vaccination topic is super important, and I'll start with the COVID vaccine. I think this is really, really important to get vaccinated against COVID for kids who have autism diagnosis. And I'll tell you why. In the midst of the pandemic, I had a lot of parents, worried parents, asking about the safety of the vaccine, but they understand the need for their children to have it. For example, somebody who cannot tolerate the mask has, usually kids with autism have sensory issues. They are not able to keep their mask in school, or if they go shopping, or if they go to visit a family member. That's number one. Younger kids who have diagnosis with of autism a lot of times have mousing behavior, where they put toys or non-edible objects in their mouth, and therefore they can get infected, specifically with COVID virus, COVID-19 virus. So I think COVID vaccine is a lifesaver, definitely. Unfortunately, I can mention the same examples. Some of my patients, older ones, adolescent patients, were lost during the pandemic because they were not vaccinated and unfortunately had a severe COVID infection. So I think COVID vaccine is very, very important. And I can tell you from my professional experience that vaccines work. Not only COVID vaccines are important for kids with autism, but I often hear a question from the parents. They've heard of some studies, especially in Europe, about 20 years ago, which were pointing to the vaccines as a cause of autism. And maybe it is a correlation between so much use of the vaccines nowadays. We vaccinate against different diseases and vaccinate multiple times, and the rate of autism, which is rising, especially in New York community, and especially on Staten Island. Unfortunately, 1 in 59 children are diagnosed with autism, 1 in 38 boys, 1 in 52 girls. And we still don't know why is it happening, but we know for sure, and there are plenty of studies which showed that there is no correlation between vaccine administration, and specifically about measles vaccine, and autism. So I just wanted to let the community know that this is their very well studied issue. We are sure about that. And again, mention on the other hand that this is the choice that parents have. Of course, nobody is going to force to get their children vaccinated, but I want the families to have an educated guess. So if anybody wants to look into the studies, we can give the information and do our best in terms of education of the families.
And that's the relationship that people have with their pediatrician. Again, someone who has autism going to a behavioral expert. The idea is you have to have faith in the people that you go to. I mean, there are patients who come to my office and to all of our offices every day. They don't know what they have. They don't know what the treatment for it is. And this is one of the privileges of being a physician, is they allow us to interact with them and give them things that we think are beneficial. And not everybody needs 20 opinions. They listen to if they trust us, then basically they were able to give them hopefully the proper medicine and the proper treatment. Well, let's talk about autism itself. You were mentioning something, and maybe I'll clear it up for me. Is the incidence of autism higher in Staten Island than other areas in this geography?
We talk about prevalence of autism, and yes, it turns out if you look at the border rates, Staten Island comes on somewhere higher prevalence, 2.9 to 4%. So we don't know why is it happening. We would like to look into this issue, and I think look into some factors in the community, in the environment, maybe in socioeconomic factors which affect the rates of autism. So we always talk about prenatal risks, intranatal risks, postnatal risks, and what we know for sure is that if pregnancy is complicated, if mom has high blood pressure, for example, uncontrolled chronic medical issues, that can contribute to autism risk. Also, we know that the age of the parents is very important. All the parents, mom or dad, older than 40 years old, can have a chance of having a child who will be diagnosed with autism. And of course, we always talk about familial risks. So something in the genes, for example, if the family has one child who is affected by autism, there is higher percentage, higher chances that another child could be affected. So again, we try to work with the families and look into what was the contribution of genetic component to the diagnosis. So one of the steps that we do during the evaluation for initial diagnosis of autism is to really send the genetic workup and potentially send to a genetic specialist, just to give the family perspective, reassurance that they can safely have children if they want to, if they choose to. And actually it's very important for the family planning, because a lot of kids who are diagnosed with autism spectrum disorder are on a higher functioning spectrum. So they will go ahead and have their families. So for the family planning is very important too.
So there was a genetic test that could tell about a predisposition for autism?
There is about 9% of kids with autism diagnosis who would have a genetic evaluation. At the end we can say, okay, this gene combination definitely contribute to the issue. The yield is not that great, 9%, but I think every family in my practice who went through genetic evaluation benefited tremendously, because genetic evaluation and having genetic testing is only one part of the story. Geneticist will consult the family, answers the question, look at the family line. So it's a comprehensive evaluation.
Again, just to one last point about autism, tell us about treatment. We've seen a lot of symptomatic therapies where behavioral issues are addressed, and there are a number of medications and treatments out there, both medicines and non-pharmacological treatments for support. Is there anything coming through the pike? And again, we have so many families out there who have children with autism or family members with autism. Everyone's looking for a magic bullet eventually.
Absolutely.
And I know it's very difficult, and we have it for a number of disorders like obesity, diabetes. Is there any research going on right now, and maybe giving our viewers some hope and some ideas in the future about things that might be able to, some interventions that could be done sometime? And I'm not talking about, and again, of course, speech therapies, various other kinds of occupational therapies, but really more on a more basic science level with regard to autism spectrum disorder.
Sure. We were just talking about that the other day, that my recommendations are mostly about rehabilitation. Okay, and as you mentioned, behavioral therapy, speech therapy, occupational therapy, physical therapy is super important, especially at the younger age. And that's why I just wanted to interject a little bit about screening for autism. We do it at 18 months, 24 months, 30 months, and we work very closely with the pediatricians, trying to encourage, and I think Staten Island is doing tremendous work in this regard, especially Richmond University Medical Center ambulatory clinic. So what can we offer in terms of treatments, right? Everybody is waiting for, as you said, a magic pill. So it sounds like there is a magic pill, but only for a specific population. So females, especially female patients who have Rett syndrome, who are diagnosed with autism, it sounds there is a hope. And I think it was yesterday or the day before that FDA approved a new medication by the name of DBU, And that medication basically provides some trophic effect on the brain, on the growing brain, and shows some positive findings in terms of less of the delays in speech, some improvement in the fine motor skills, and improvement in repetitive behavior and self-injurious behavior in this type of morbidity. So Rett syndrome, which is a unfortunately very severe debilitating disease. Usually those are females who are affected. It's an X-linked disease. Unfortunately, kids lose their functions. They originally start talking and have good fine motor skills, but at the age of 18 months, they usually regress and lose those skills. So this is the hope. If this medication proves to be a lifesaver for this type of disease, I think eventually we will have something for autism, hopefully.
And that's a wonderful thought and a wonderful way for us to think about it. We have 2 minutes left. So there's the rapid fire round, or whoever wants to take this. With regard to our viewers, many of them have children, wanting to find out what's going on in pediatrics. Is there anything that is sort of different than being intuitive? Healthy diets, screening. Is there anything that we could tell our wonderful viewers out there that is happening in the field of pediatrics that you think they would say, wow?
I think, and this is what really has amazed me in the last year is the data that the #1 killer of kids is gun violence, and it's so preventable, and it has overtaken motor vehicle accidents. So one of our goals as advocacy for kids has been to really bring this up to parents, that being exposed to guns either outside or at home, can be dangerous for kids, because that's the #1 killer of kids now. And the #1 killer was for suicide in both teenagers and adults is having a gun in the home. So this is not being against having a gun. It's really, really thinking about safety if you have a gun, how to keep it separated from the ammunition, and really understanding that we have to do something about this stuff because it's the #1 killer of kids in general as of 2022.
And I think opening the conversation, I think first step is how comfortable pediatricians are to open this conversation and how comfortable parents are to at least consider listening to what we have to say and offer.
And that's marvelous. I mean, that's the kind of thing that we sometimes don't think about. On my medical show, we talk about medications, we talk about all kinds of different things. But the idea about just preventing a problem is so crucial. Suicide is such a prevalent portion in the younger population, and it's something that we hopefully could try to avoid with mental health issues, and here even accidental use of guns. So I want to say thank you to you. What a wonderful show. It's been a pleasure to have you all here. And I want to thank David Marcus again on his award for our show being named the best health show on Staten Island with regard to the cable network we're on. And say thank you and good night. Good job, guys.